Hey, good morning, Mayor and councilors. It's Chief Heppel again with your weekly COVID update. Thanks again for the opportunity to present via the video format for this week. As usual, we'll go ahead and start with just a reminder as to why we're here. As we turn the corner, the governor's Stay Home, Stay Safe initiative was actually put into place March 23rd, but we backed that up a little bit. We really started getting into our preventative measures with social distancing and things, actually about a week before that. So we're actually moving on to almost 3 months that we've been dealing with the COVID pandemic. Our protective measures went into place in an effort to flatten that curve. So, and flatten that curve to save on our healthcare system capacity, which because of our early action and interventions and simply our community being proactive, we effectively did flatten that curve, and we're seeing the results of that today. So let's look at some of those results really quick. So local data as of about 8 o'clock this morning, we have 77 total cases in the county, cumulative. 64 of those folks have recovered. We have one in the hospital. It's actually been quite a while since we had someone in the hospital. Our deaths actually, unfortunately, went up one more. However, that death, from my understanding and conversation with public health, has been that person actually transitioned in early May. So all the details behind that I'm not familiar with, but it wasn't a recent transition or death. And then we have 9 of those folks who are resting at home. So those numbers went up, but again, good to see that we don't have a whole lot of folks in the hospital at this time. We looked at the chart to the right, so our epi curve, and we continue to stay down in that low area. As I always like to remind folks, is if we take a look over here at that, our y-axis, these are single-digit numbers, as to where in many other counties, especially around the Portland metropolitan area, these are double-digit numbers, so 20, 40, and 60. So the fact we're here in that good place is a good thing. So we see a little bit of this cluster here, and then we had about 10 folks that increased over the weekend. So what happened there? Actually, it was a good thing. So one of which was obviously the fatality, but most of those were identified through the surveillance testing that Lane County Public Health is now doing. They've been working for the last couple of weeks, going out into our vulnerable populations. As you know, a couple of weeks ago, they tested our unhoused community at the Expo Center and our own designated temporary shelter sites, Wheeler Pavilion, et cetera. That was successful testing, and then they started moving out to some of our care facilities and doing testing there. And then they moved out into our Latinx community, and we're doing some testing there. So many of these cases have been identified through the surveillance testing, and the good part is that many of those were connected to previous cases, and they were able to do some successful contact tracing. So while that does seem like a substantial jump, it's because we're doing more testing out there. So how much testing have we done? Well, I believe last week I was around 10,000 tests that we did, or we're pushing 10,000. I think by the end of this week, we'll be pushing, once results start to come in, I think we'll be pushing 12,000. So pretty substantial jump or ramp up that we're starting to see now in testing and getting those things accomplished. More and more testing is becoming available. Peace Health is starting to do a lot more testing. Again, with all the folks coming in through the ER and those getting elective surgeries, we continue to encourage our family health practice folks, primary care providers, to get folks tested, even if they have minimum symptoms, to get more and more tests available. So that's another good direction. The challenge that we'll see when it comes to the numbers is with our gatherings this weekend. So we estimated, I've heard estimated numbers from the gathering on Sunday is 7,000 and maybe more than that. It'll be a little bit of time to allow the disease process to move through, if that is going to create some sort of a spike in our data. So we'll certainly keep an eye on that and look for the outcomes. Taking it up to the 10,000 foot view, looking at it from a state perspective, the state continues to be in a relatively good place with those declining calls. More and more testing are continue to transpire across the state. So again, we're getting into a good place there. So phase 2 criteria, apologize, a little bit of an eye chart, but I'll leave it up for a little while for you. As we get into phase 2, the entry criteria was released last Thursday. And two things to remember when it comes to that. One is for phase 2 criteria, you still have to meet phase 1 criteria, which is on the left-hand side of your screen. So we still have to see the percent of ER visits to COVID-like illnesses for the state less than historic average for the flu, the same time of year. So this time of year is the non-flu season, and that runs from May through September in our area. And historically, we see, according to the Oregon Health Authority website, we historically see about 1.5% of our ER visits are for flu-like symptoms. Currently, we're running 0.5, so we're definitely less than the historic average for that. We continue to see some declining admission for COVID. Certainly that doesn't affect us. While we had one case, it's not a really valid data set. We being public health has established a strong contact tracing program in conjunction with the University of Oregon. The adequate isolation and quarantine facilities. So we now have the River Avenue facility, which Lane County Public Health purchased about a month or so ago. And that facility has about 40 to 45 bed facility that can help with those folks that can't quarantine, say at home. We are doing the aggressive testing regime. In fact, today they're scheduled to do about 400 tests in our local area. So that's great. And certainly the healthcare capacity, we have the capacity within our healthcare system. Speaking with Peace Health and Mackenzie Willamette at the incident commander meeting yesterday, we meet that 20%. And we continue to monitor and maintain sufficient personal protective equipment. So all those things we've met we continue to meet that criteria and keeping the curve flat from that perspective. So if we look at the phase 2 criteria, we go back to that tracing. So 95% of all new cases have to be traced within 24 hours. And we have to have successful tracing, not just do it, but as successful as indicated by a minimum of 70% of new cases must be traced to an existing positive case over the previous 7-day and 14-day time periods. So when it comes to that piece, that goes back to that community spread. It's one thing to take a new case and trace it back to an existing case. It's another one to have a lot of new cases that are not connected back to an existing case, which might be an indication of more community spread. We also want to see, we don't want to have an increase in cases or positivity. So we don't want to have 5% or greater increase in new cases in the count over the past 7 days. Or we cannot be a significant increase in the percentage of positive cases out of total tests taken out of the county. And you'll see just simply the asterisk that's associated with that. So if it was a controlled outbreak in like a group living setting or a work facility, like we've seen up north and say like that canning or food processing facility, that wouldn't necessarily count because that's an isolated incident that they were able to do extensive follow-up testing and isolation, et cetera. So we're looking more at a community spread perspective. So we're still meeting phase 1 criteria. That allows us to look at phase 2. Lane County Public Health did apply for us to enter phase 2 testing or enter phase 2. That, if my understanding is, that's being evaluated today by the governor's office. They're pulling the data to make sure that we meet the phase 2 criteria. And I suspect we'll find out probably tomorrow if we're eligible for that. So what does phase 2 bring us with the reopening? And I would say, I'd say not a whole lot. We haven't seen a lot of guidance, specifically the sector guidance that we saw with phase 1 with regards to our different sectors such as, personal care and gyms and restaurants, et cetera. So we anticipate will be more of that coming as time goes along. But what we anticipate seeing is optional increased work in offices. So businesses, that aren't as necessarily where they're keeping a lot of folks out of their offices. They're able to bring more folks in. So in-personal local gatherings for up to 100 with physical distancing. So I've heard a couple of numbers, not confirmed yet, but one is it's 50 indoors for local gathering and 100 outdoors. But you could imagine 100 people trying to maintain physical distancing there. That that piece, that's a pretty good size area. So that'll be something we're going to watch in terms of gatherings and people wanting to come together, et cetera, especially with the time that we're in with the current folks protesting. Limited visitation to congregate care. So this is your facilities, like nursing homes, could even be potentially the hospitals, rehabilitation centers, et cetera. And that limited visitation, again, we haven't seen specific guidance on this, but it's still going to be heavily regulated. So folks would still have to get their temperatures checked and not show any symptoms, probably answer a few health questions. They'd have to sign in for contact tracing purposes, et cetera. Time might be limited, wear masks, et cetera. So that's, we'll find out more as we go forward. Again, we're eligible as soon as June 5th. We'll probably find out tomorrow on the 4th. But again, it's not going to be this large opening of facilities and changes in our current environment. So then we start looking to phase 3, where things would probably return back more to a normal environment. We'd have more larger facilities and venues, concerts, conventions, sports events, et cetera. And what we're looking for there is that reliable treatment or a vaccine. So that's where we're at this week. We're in a good place. There's been a lot of work done by Central Services, as well as the Employee Resource Center, who have been working diligently on the reopening plan for the city of Eugene, and how do we bring back our employees safely, but most of all, how do we keep our community safe and start to provide some more of those traditional services. So an example is going to be like the camps, so like the day camps for kids, et cetera. That registration again starts June 8th, and then camps start on June 22nd. We would also be going to be looking at things such as the pools, and can pools start to reopen, and how do you do those things safely. So that's where we're at right now. We continue to move forward in a positive direction, and we're pretty excited about that. So with that, I hope you all have a great week, and we flattened the curve, and certainly now let's hold it, and let's hopefully we can enjoy our summer. Have a great day. Thank you.